Hi, I'm Sarah.
And I'm Cameron, and we're second-year Doctor of Physical Therapy students at SBU.
We're going to give you a tour and show you around.
So this is the musculoskeletal lab. We learn things like special tests and a lot of things that are applicable to the outpatient setting in here, manipulations, mobilizations, things like that. We learn a lot of passive modalities and we practice our physical assessment stuff in here, screening, different range of motion, manual muscle tests, and sensation, things like that. And then in here, this is the neuro lab. And the beds are a little bit bigger so we can practice bed mobility and doing different techniques like PNF, NDT, things like that. And they'll leave assistive devices, extra pillows, mats, and things like that in here for us to use as we need to practice. This is our patient room where we can practice different techniques used in hospital setting. We have a mannequin here that we can practice different things on, and there's a lot of cords and things so we can practice before our clinicals in the acute setting with all these lines and everything like that. This is the Gait lab, and our pediatric PT also uses this in the clinic working with little kiddos. So there's a lot of toys and things and the harness system that she uses with them. And then we can also practice working on stairs with patients, and we have our parallel bars, and then that back closet has a bunch of different assistive devices like crutches, walkers, hemi-walkers, and things like that.
This is what we call our research lab, where we have books available for you to come in and utilize. This is also a really great study space. And then for any of our patients in the clinic, we can bring them over here and hook them up to this harness system over the treadmill if we need to unweight them at all so that we can work on their gait. In here we have our computer lab / study space. So we have two big TV monitors that you can connect your computers to and screencast to. This is really good for study groups. I utilize this so we can all see the information and quiz each other. There's also 4 individual testing rooms that you can get approved for early testing, extended testing, and they're also just great study environments to come in if you just need a quiet, dim lit space. We also offer these computers if you need to come in and do any standardized measuring or anything like that. And we also offer what we call mindful movement, which cancer patients struggling with fatigue after chemotherapy come in, and they do a little bit different type of physical therapy, not in our clinic.
This is the student common area, so we all get to have a locker. You can keep your anatomy scrubs in there, your lunch in there, different tools that we use, and then we have microwaves, fridges, things like that, and then lots of tables for lunch and studying and everything like that. This is the anatomy lab. So this is where we keep all of our cadavers, and just picture there being a lot of cadavers in here. There's 4 to a body. So you really get to dive in and you get a really good look at all the muscles, all the nerves, everything like that. And these tables are the tables that they'll be on, and they're usually in lines here. And it's really nice because if your body is missing something or you accidentally cut it like my group did, you can just turn around and see another body. This is the back dock where we have our Go Baby Go project. So we get sent all these different cars and they come in pieces and we build them and give them to children in our community who either have motor planning difficulties or gross motor difficulties and they can't drive a standard toy car. So we modify them so that they can explore their environment just like a typically developing child.
This is what our first years use as their classroom. We offer standing desks for anybody that needs to get up during lecture and just can't stay sitting. We also have in here the skeleton and stuff for kinesiology, so we are able to look at the bones straight on. And then you also get to look at x-rays and MRIs and everything during diagnostic imaging in your first year. Then once you complete your first year, you'll move over to our second year classroom where you'll spend your next second year of didactic work there. Now we're gonna head over to the clinic where we see our patients pro bono. This is our faculty clinic. Here, students get 6 weeks each semester with a faculty member along with another fellow student. Basically, you come in and you see patients from all around our community that we offer for free, whether that be we are doing an eval or we're just doing an everyday treatment plan. You get those 6 weeks, and then also there are opportunities for volunteer hours.